most of you have told me that you guys are new to art and done some, new to some, and some of them are saying, I want to know more. All right, that's definitely a good mix. I got PTs, OTs, pediatric, acute care, long-term care, everybody in here. Excellent stuff. So I'm not going to talk a whole lot. We're just going to get into this. Yeah. So let's run through the objectives, which I'm going to speak verbatim. So first of all, it's a skill-based webinar. It's always tricky to deliver a skill-based webinar because you are kind of trying to emulate this skill via videos and slides and perhaps my gestures as we go along. So it's to acquire hands-on practical experience, which I believe you guys will go ahead and practice in your own settings. Grab a family member if you want somebody close to you right now. If there's a child hanging around somewhere or a spouse hanging around, loitering around in the house, bring them on, have them sit down, right? We are going to learn about proper body mechanics for ourselves. It's like goes with any skill-based maneuver that we want to protect ourselves just as much we want to protect our patients. And we've got case studies, we've got some evidence-based practices, and it's a bit of a mixture. So what I'm going to hope to do, this is the plan, that for the first 35-40 minutes-ish, I'm going to really emphasize on the theory behind this and to understand how we're going to apply art to different areas of the body. It's necessary to know the physiology and the anatomy behind the structures and the conditions that you're going to work in. Then you're going to be able to apply it to different areas of the body, all the way from TMJ to plantar fascia, really. That's going to go on for the first 35 minutes-ish. After that, I've got several videos. Now, some of the videos are the videos that I have shot. Some of the videos are the videos that I've borrowed from YouTube. If it's okay, I will probably give you guys some resources and channels to look at as well. The reason why I have gone out of my zone to borrow videos from YouTube is because every practitioner has a different approach to doing active release therapy. So for instance, if you look at release for the psoas, you will find active release therapy with 3 or 4 different versions of how somebody does it in supine, somebody does it in side lying, etc. So the techniques that most resonated with me, and for a couple of them, I've got 2 different approaches